steal this from you.
That's good.
Yeah. All right.
Okay,
There we go.
we're live.
Yes,
We are. Well, hello, everybody. Thank you for coming. We're going to have some good time this afternoon here at the Low Country at Bluffton. And today, we're going to have an introduction. It's going to be a little bit of okay, good. It's going to be an introduction actually to holistic health. But of course, we're going to talk about hormones, which is one of the major issues in our life, through our life, but especially as we get a little older. Also on the female and the male side. Okay. So nobody's really good. Okay. So can I get the first line? Okay. So first of all, when we say holistic medicine, what do we mean by that? What is holistic medicine? Holistic medicine is really getting to the bottom line. It's not about it come with a symptom, give us something to kill the symptoms. Okay. Because I compare it to driving on the highway 95 at 75 miles an hour. And we have a red light. So, like a good person, what we do, we stop over the side, open the hood, trace the wire to the red light, cut it, shut the hood, continue to drive. That's what we do when we give medication. Okay. And again, I'm not here to bash conventional medicine. Conventional medicine has a point, has a place. In my humble opinion, being in medicine for 43 years, both sides of the equation, it's great. Usually it's good with emergencies. Okay. But tell my patient, you have an emergency, get it done, get out of the hospital, get out of the emergency room, because it's not a good place to be. Okay. So a lot of people ask me, okay, what made you change? Because originally it's not GYN, babies. Okay, thank you. And I can tell you one thing. I don't know of any doctor who wakes up one morning, they say, well, today I'm going to be holistic. There's always a reason. And usually it's a personal reason. In my case, my neck and back said, you know what, after 25 years of working like you probably go 50 years, it's like $100 a week. God. And of course, it's not a good day because I was trying to do what I was trying to do, doing very well. But luckily, instead of staring at the door that just shut in my face, I said, okay, what other door? And I opened the door I like to call the real medicine. And I realized how much they didn't teach me. Okay. And in the beginning, I was like a little confused. It's like, well, the reason is that the holistic approach at this point is not compatible with the business of medicine. Okay. And if you are interested in research, and you can look up the Flexner report back in 1910, under the guise of the Rockefellers, that changed the face of medicine in the United States because he put a report to Congress regarding the medical education in the United States. And in his wisdom, he decided that the other medical schools that's supposed to be supported by the government, the allopathic medicine. So the homeopathic was closed, the botanical was closed, etc. And here we're moving back to the original. So that's kind of background. So it's a different approach, okay? It's a system-oriented approach in conventional medicine. And all the testing we do, I have patients come to me with that style of tests. I mean, if you look at this, probably $20,000 worth. Most of them are unnecessary. And when I see something that should be addressed, I say, okay, so what did they tell you about X or whatever it is? I said, nothing. Just to say, why are they testing for it? Okay. So our approach is what? Education. Okay. We're staying away from fear. My major issue with conventional medicine today is when I see patients really in a state of high stress. They're almost like shaking because usually I'm the fifth or 10 doctors that come to see me, and they kind of expect this scenario. They say, no, this is not. This is a way to actually find out what's on and fix it. You should see the reaction of the patients. You're not sick. It's like a shock. What do you mean I'm not sick? I've been told I'm sick for 30 years, 40 years. Guessing people. I say no. Most of it is functional. It can be fixed. So I tell them, you're in control. You're in charge. What's conventional medicine say, take this and have a nice. And if you don't do this and this and this and this and that, you'll die or I don't want to. We don't do it. Our job is, and by the way, the original doctor, teacher. Okay, so when's the last time you went to the doctor to do anything? You don't have time to even look at your eyes. Because they have about 6 minutes. Okay.
The average medical visit's 3 minutes in the United States.
Crazy.
It's insane.
Okay, next slide. Okay. So, of course, lifestyle is very, very important. A lot of it can be changed as far as your health. And we're talking about diet. What we eat is very important. Okay. And I tell my patients, it's not difficult. So you have to ask three questions before you put anything in our basket. Number one, did God make it? Question. Number two, did men touch it? Also a good question. Number three, is it organic? If it is, yes. I like the keto lifestyle, and I'm saying lifestyle, not a diet, because nobody can follow a diet long term. It's hard, it's not sustainable. That's why everybody that needs to lose weight goes down and up and up and down. What is a keto light or keto lifestyle? Less carbs. Okay, usually anything that comes in a box, leave it on the shelf. You have to make something fresh. Okay, so you say, well, what kind of recipes? It's very simple. You have a protein, you have a vegetable, you have a good fat. Okay, avocado. Okay, olive oil, coconut oil, avocado oil, grass-fed butter, ghee, and a salad. That's about it. I also recommend what we call intermittent fasting, which means giving us at least 14 to 16 hours of no food, because the majority of us are doing what? Because why? It's available, we like it, it's social. So,
Good.
60, it's good, and 65%. Okay, so we're talking digestion is absolutely a major part. Okay. I tell my patients, get our gut healthy, and you have a good. Okay, so we should not have heartburn, we should not have blood clotting, we should not have any constipation, diarrhea, loose stools, any cramping, any discomfort whatsoever. If we do, we need to take care of it. And it's not by medicine, it's by finding out what's missing. It's usually either hydrochloric acid to help digest, with enzymes, probiotics, and also certain remedies that help close the gut. Have you heard about leaky gut? Okay, leaky gut is increased permeability of the lining of the gut. Okay, and it's really I call it the lifetime achievement award, because we all have some degree of leaky. The question is, which one of us have it to a point that creates symptoms? Okay, so there's continuous watching the gut. Help my patients in holistic medicine. If we don't move our bowels at least once in 24 hours, it's a medical emergency. Exactly. It's like, what are you talking about? Well, think about it. The speed of food or the time of transition from mouth to evacuation is 8 to 12 hours. Here we have 24 hours without evacuating our mouth. What do you think is happening? Toxicity. Okay. We're overburdening the liver, the kidneys, the skin, and that's why we are actually hampering the immune system ability to protect us. Anecdotally, I can tell you one thing. The majority of people who come down with diagnosis of cancer have chronic constipation. Yeah, chronic constipation. So again, how do we prevent it? Lots of liquids. Okay, we need to consume at least half a body weight in water, in ounces. So if we weigh 160, we need to have about 80 ounces of water. Okay. Here, especially in the South, we need to add all sea salt to the water or to the food. Okay, and I underlined sea salt. Okay. Also, we need to take fiber, fruits, vegetables. Okay. Probiotics are a must. And again, I know we're not talking about gut, but it's so important before we kind of move into hormones. Okay. So what do we have? We have and what are hormones to begin with? Hormones are proteins. And they're secreted by different glands. We have the thyroid gland. We have the thyroid gland right over here. We have the adrenal glands up on the kidneys. Okay. So the thyroid secretes two main hormones, T4 and T3. Okay. T4 is not an active hormone. We go to T3 in order for it to act. So what is it? T3 speaks to every cell in the body. How much energy to make. Pretty important, I would say. The thing is, the majority of us walking around. You say, what do you mean? I just came from my doctor. My endocrinologist said all my bloods are perfect. Yes. 80% of lab tests do not show undirected neuron. We know, because when I give those patients who supposedly are on blood tests, thyroid support and adrenal support, all of a sudden they want to say, you know what, I have a life. Well, after doing it for 24 years and I was sleep I didn't realize, you know what, you cannot trust just a blood test as your Bible. You have to listen to the patient and see what's happening. Okay. Now, adrenal hormones, the adrenal glands are the stress response gland. Here we have two of them. Meaning what? When we get into stress, those glands are pouring out adrenaline, noradrenaline, cortisol, blood cortisol. You know, to do what? You know, to save us from the tiger. Okay? The problem is that in 2024, the tiger goes to sleep. We're all the tiger just behind us. And we're always stressed. And what happens, we get into a situation we call, okay? The adrenal works together with, so if most people have a thyroid deficiency, they also have adrenal fatigue. Okay, and I've never seen a patient come to me after seeing an endocrinologist on adrenal support, just exercises. So I say, wait a minute, I mean, it's part of medicine. Yes, the two conditions that they kind of acknowledge. One of them is totally over top, so to speak, adrenal function, okay, which is called Cushing's disease. Or Cushing's disease when they completely shut down, can't get out of bed, and you're about to register because they think you're done. Okay, but in between, there's a big span that can be addressed before we get to situation.
So Dr. Dekel,
Yeah.
I had a patient text and wanted to know if the cortisol levels are the only thing that you need to focus on if you're gaining weight.
Absolutely not.
She had a doctor reach out and specify that it was just cortisol.
No, I told you this question about cortisol. Cortisol, which is high when stressed, until we get to an inability of the gland to actually, now we have too long complicated out of that. But cortisol is really the culprit of adiposity. In other words, putting fat on the belly. Okay, but this is only one thing. Okay, so and again, as I said, the thyroid, T4, digestion, inflammation, all of these have to do with gaining weight. Okay, so again, this is a whole lecture, and not a lecture about weight loss, not weight loss, retaining health, good weight. Okay, thanks for the question. Okay, okay. Insulin, of course, is another hormone. Okay, again, the majority of us are now type 2 diabetes, which is actually to lifestyle. Eating too many carbs. You can cure type 2 diabetes. Avoiding carbs, food diet, or lifestyle. Reversing insulin resistance. Okay. Again, when we're consuming too many carbs, what happens? The pancreas, which is actually making insulin, part of that, is responsive to blood sugar. So sugar is with carbs. Over there, some of those carbs. Sugar rises, sends some insulin. Insulin goes to the blood. What happens? The cells take the sugar from the blood into the cells to create energy and to sustain life. The problem is we continuously have a carb diet, okay, and continuously have high sugar. This pancreas pumps out insulin like this. What happens is the cells are listening to insulin, perceive it as too much noise. And what they do is they down-regulate the receptors. Receptors are little microphones that listen to the hormone. The hormone has to connect, create an issue. Too much noise, they shut. And that is insulin resistance, okay, which is totally reversible within months. Just cutting down carbs. So again, it goes into what? Keto lifestyle. Okay. Okay, melatonin, very important hormone. Melatonin is produced by the pineal gland. Pineal gland in the brain. If you take a small, if you square pound in, it's about this deep, this level. Okay, what happens at nighttime? Okay, close our eyes. The pineal creates melatonin. Melatonin is inducing sleep, especially good sleep. Rapid eye movement, deep sleep. Okay, again, the way that sleep is, I'd say probably 40% of us have a good quality sleep. It's amazing what melatonin and other supplements we have can totally reverse that. Again, in holistic medicine, sleep is more important than food. I want you to kind of sink in. When we sleep, we repair. Don't sleep, we don't repair, we get sick. You know, we accelerate the aging process. So it's absolutely important to do that. Okay, oxytocin. Oxytocin is very important. Oxytocin is actually relates a little bit to pregnancy because it's responsible for uterine contraction. In fact, in gland, use oxytocin on a regular basis. to induce labor if patients who need some help with contractions. It's also secreted when the baby nurses. That also because it causes contraction of the glands in the breast to help the milk produce. It's also being, by the way, produced when we have. It's the bonding hormone. So that's a good one to have.
Yeah.
Yeah. Okay. Next. Okay. Now we have some control centers because, as I said, all these hormones have. Okay, so we need to have some kind of control and command. And all this is automatic. We don't have to think about it. Oh, I need some more cortisol. I need some more adrenaline. I need some more. This is all automatic. It's kind of balanced back and forth between and how much are being produced. So it's all like an autopilot in a way. Once it gets a little bit of crazy, so we need to help it. Okay, so we have the thymus is really like CPU brain. Okay, the central processing units takes everything into what's happening in the body, what's happening outside the body, and digests it and sends its signal to the pituitary. Pituitary is a gland in the base of the brain. It's about the size of a pea, about this one. And the pituitary is making TSH, thyroid stimulating hormone, to make ACTH, which is what tells the adrenals how to work. Okay, how much progesterone, how much testosterone. So this is really the command structure of what's happening. And the feedback, okay, as I said before, if hormones goes a little high, too high, it gets back to the pituitary. Wait a minute, I don't need that much. Okay, so again, nothing in the body is spiritual. It's always ups and downs, ups and downs. Okay, and sex hormones, progesterone, and testosterone. Okay, so obviously the ovary uses estrogen, progesterone. Okay, and if you look at the menstrual cycle, the first 2 weeks of the cycle, we have estrogen on board. The estrogen is a growth hormone. It tells the breast to get ready for pregnancy. It tells the uterus to get ready for pregnancy. So it's really getting the lining of the uterus to get ready for pregnancy. Ovulation occurs around day 14. Then the ovary changes from making just about estrogen to making a lot of progesterone. Okay. In fact, if you take the ratio between estrogen and progesterone 24, I have 150 times, 200 times something. Why? Yes, we're going to have some light. What? They said this one is a growth hormone. Progesterone is supposed to stop it because controlled growth is a good idea. Okay.
So why does it triple on day 24?
Why?
Yes.
Because the estrogen is a very strong hormone. And you need 200 times more progesterone to say, okay, also mature tissue is inside you. So as you go into menopause, or perimenopause, happening, progesterone falls first. Okay? That alone can create what? It's hot flashes. Okay? So as we change, okay, I have to find out what we need to do. Okay? Because not everybody that has hot flashes needs estrogen and progesterone. In the beginning, you probably need just progesterone. Okay? And then what happens a year later, and that happens usually at the age of 48 to 50. But it can happen earlier and it can happen later. Okay. So when we give progesterone for the early onset of, let's say, hot flashes, they disappear. Okay. Later on, when we go into full menopause, that means what? Ovary has ceased, stopped making estrogen also. Okay. Now we can get a second bout of what? It changes. At that point, we suggest that we what we call bioidentical hormone replacement therapy. Okay. What's the difference between that and conventional? Well, conventional gives you prescription drugs that are not natural hormones, because natural hormones are substances that cannot be patented. But if you change one molecule on those hormones, that's your property. And you can patent it. And once you patent something, of course, you can charge whatever you want to charge. So what we do is we use identical natural hormones. Okay, of course, we do some blood testing. We do blood testing, could be urine testing, could do also some lab testing. I usually do blood testing actually to support what I already clinically see. It gives an idea to how much, etc. And we give it to the point that one, consciousness. Number two, protect what? Protect your brain. Okay. Women who are not having identical hormone replacement will have a higher chance of dementia and also Alzheimer's, which is a different type. Okay. Osteoporosis. You've heard about osteoporosis. Okay. Once we lose estrogen and progesterone, we are losing calcium from the bone, and therefore we are prone to have fracture. Okay. Again, conventional medicine uses medication to increase bone density. The problem is, yes, it does increase bone density on testing, but it also increases the likelihood of spontaneous fractures. It's not a good idea. So we need to actually seriously look at how to prevent osteoporosis if we can. It's much easier to prevent right away. But if we start to have it, stop it before it gets too deep. Okay. Okay. Let's talk a little bit about testosterone. Testosterone is important not just for men, but let's move to the men a little bit over here. Men lose testosterone 2% per year for the age of 25. Okay? So, a man at the age of can have about 40% less. Well, why is it important? Because testosterone is for men's psychic behavior, feel. We have tremendous amount of receptors in the male brain that needs testosterone. That's the hormone that makes us get up in the morning. Obviously, it's very important for libido, muscle mass, very, and also prevention of osteoporosis. I have men come to me, get themselves, diet, lifestyle, exercise, etc. Go to the gym 4 times a week. We eat well, and we're losing muscle. Say, okay, let's check testosterone. It's a little low. Support testosterone results and regaining muscle. So, as far as women are concerned, all out of testosterone, which is also important for what? Libido, okay, and muscle, osteoporosis prevention. Okay. And again, women usually use about 1. Okay. And how do we know? Well, we do some testing. Huh? Okay. I have a lot of women in their menopause that okay, so 2 different hormones with that. One is HEA, which is adrenal hormone, and the other one is, and again, they get excellent results. Okay, next one. Okay, so let's go back to the thyroid because it's such. Okay, so we said we have 2 main hormones. T3 and T4. Okay. What is T3 and what is T4? Why is it called? Because a T3 molecule has 3 iodines, T4 has 4 iodines. Okay. Again, remember, T4 is become T3. Okay. And a T4 to the right, which or we can go to the left, which is what does it mean? Why do we have reversed? This is there to stop if we have too much. First T3 gets promoted. It occupies the receptors and prevents the T3. Now we're getting into what we call thyroidism, which is a good thing to have. Obviously, excessive metabolic rate, jitteriness, nervousness, muscle loss, puffy eyes, and on and on and on. Okay, so that's the issue first. And let's talk about cortisol, right? Cortisol. Okay. We have continuously high amount of cortisol. The T4 moves reverse T3. And therefore, if we have high cortisol, we're almost always going to have underactivity. Because we can have the regular amount of T3, but the amount of reverse T3, that regular T3 is not going to do its action. So again, cortisol is high when we have. Okay, so in our practice, we also address stress, et cetera, et cetera. Okay. Okay. Actually speak to the mitochondria. Mitochondria are small little organelles in each cell, and they are the factory of energy. Okay. So the T3 tells the mitochondria how much, creating what we call the basic metabolic energy we have. Okay. It also controls body temperature. When I do my muscle testing, physiology, when I get your hands in mine, immediately, if you're cold, guess what? You have active thyroid. Because the thyroid is also, it's a thermostat. It's how much energy we make. If we don't make enough energy, 98.6. And what does it mean? Every change of, especially if it's more than 1 degree, affects the effectiveness of enzymes. Enzymes are the, nothing happens in the body without enzymes. So if the temperature goes down, then less effective, and everything is not working well. Okay. All right. So what do? To measure that, they get centigrade levothyroxine, which is what? Which is T4. T4 has to convert to T3 to be active. Some of us will have a little problem converting T4 to T3. So what do we accomplish? Nothing much. Okay. On the other side, we have vegetable. It's made from a plant. It's called T4. Okay. And it contains 80% T4, but 20% T3, which is active, ready to function. Okay. So if it comes to me and they're not converting well, usually we move them to natural. Okay. Something else that I want to point out: conventional medicine treatment of thyroid issue. The main decision of how much hormone you use depends on hormone, which is called TSH, thyroid stimulating hormone. The problem is that I see a lot of patients come to me with perfect TSH, yet they have no energy. And at the end of the story, diagnosed to have underactive thyroid, on thyroid, we felt better immediately. A month later, we were supposed to do some blood work. just on the regular physician. And so how are we doing? I said, we're doing good. And they said, "Okay, look at the labs." "Oh, we have a problem." "What's the problem?" "I gave you too much." "What do you mean?" "Your TSH is too low. We need to get it levels." "I feel good. I don't feel like it too much. I don't have palpitation. I don't have jitteriness. I have jumping out of my skin. I have no sleep disturbances. So what's the problem?" "You don't understand the signatures. We need to get you. What do you got to do?" "All right, so give you a new prescription. You take that, come a month later, blood test. How you doing?" "Well, I have energy." "Let's take a look at the blood test." "Wow, you're perfect. You're perfect. Your TSH where it's supposed to be. But I don't have enough energy." "So you're depressed a little bit?" "Yeah, of course I'm depressed." "All right. Well, I have a solution for you. I'm going to give you some drugs." And that's the way it goes. So I can tell you one thing. I've done it for so long that not most, all of my patients who have energy and have a life, supplementation of thyroid, have low TSH. So I asked my patient, "Do you want to look good on paper?" Well, the answer is ubiquitous. Yes, I want to. But I tell them, when you go to see a conventional doctor, they think those lab tests, they're going to have a little heart attack. You just be ready. Right. All right, next slide. Next slide. Okay. So again, the clinical presentation, fatigue, can't lose weight, depression, constipation, regular periods, infertility, just about anything. Underactive thyroid responsible just anything. Next slide. Okay, let's continue. Hair loss. Most women who have hair loss have thyroid issue. Okay, and we can fix it. Okay, loss of the eyebrow outside of the eye. And I see some people say yes, yes. Outside. Memory loss, brain fog, dry skin, elevated blood pressure. And we talked about synthetic versus the natural. Okay, so next slide. Okay. We talked about accentuated levothyroxine. But conversion, it requires energy to begin with because we have the electric thyroid. We need selenium, we need enzymes. So not all of us are converting. If we're not converting, we're not going to have the right energy. Sometimes we have what we call antibodies in the thyroid. It's a blood test. Again, the antibodies, what are antibodies? Antibodies are guided missiles that the immune system creates to a specific target that has to destroy, let's say, invaders, organisms, stuff like that. So we have leaky gut. What is leaky gut? I'm going to give you a simple illustration. Okay. If this is one cell in the gut, this is another cell in the gut. This is healthy gut. This is leaky gut. On an electron microscope, so even if you do a biopsy, you're not going to see it. 1,000 times to see it. But those gaps between the cells are enough, not supposed to go in, not supposed to go in. So what happens is the immune system responds with what? More is going on. One of the ways it fights it is getting those guided missiles, antibodies. The problem is that some of these invaders, genetically and molecularly, look very similar to the thyroid. So those antibodies say, wow, we have a big enemy. It's not attacking it, now we have inflammation, now we have all 𝘏𝒂𝙗𝒕𝙠𝒻𝒆. Okay. Hashimoto can be 80% usually low. 1% high active. But even the high active is low. So again, what do? Fix the gut. And again, it's a lifetime achievement. Okay. So the next one. Again, let me just talk a little bit about what is that. It's a relatively new concept, not new, but I would say 10 years. And like even conventional medicine now realized the microbiome, which means what? What kind of bacteria in the gut is affecting us in a major way. Okay. Figure this way. We have about 95 trillion cells, give or take a few. We have 10 times bacteria in the gut, which means what? We're 90% bacteria and 10%. Think about it. I know, it's frightening now. It's not frightening, it's the way it is. So everything that happens in the gut affects everything. Thoughts, emotions, level of just health. So we have two types of bacteria in the gut, those and those who hurt us. And our job is to increase the which means what? They consume our toxicity and create some vitamin K, okay, 3,000 different enzymes. It's their rent that they pay us for living in them. Good exchange, pay rent, let you do it. Now, the bad ones are the ones that you actually consume nutrients and toxicity. So our job is to support our bacteria. That's why don't go without your probiotics. Very important. Very important. Okay. Talked about the adrenal thyroid connection. Okay. The lab testing issue we spoke about. Again, normal level should be between 2.2. Okay. So that means if you're 2.2, you're normal. That's of T3, that's the active hormone. Well, we didn't check 5 years ago to see what your T3 was. Maybe it was 4.5 and now it's 2.2. Especially when complaining with all the symptoms we talked about, of course not. So we need to take it in consideration. We have also those patients who really not doing well on synthetic thyroid can be changed into natural one. The formula can change. And the majority of them will do just fine. Actually comes from me and they're absolutely fine. I don't reinvent the wheel. If you could, good. Okay. We talked about the adrenal gland. They're in charge of stress response, also potassium regulation. Cortisol is being done by the adrenals. And here they are, right here, at the top of the kidneys. Okay. Right here. Okay. So cortisol is stress hormone, but no health. Okay. Adrenaline is the emergency hormone. Blood pressure is regulation, blood sugar regulation. Okay. And all mammals have adrenals. They don't, they usually don't survive the generation. Next slide, please. Okay. They are lifesavers during emergencies. The issue is that our lifestyle is perceived as continuous emergencies. And that's why we get adrenal fatigue. That's why most people this. Okay. So what happens is deer survives the okay, what it does, it just gets rid of the stress and regenerate the adrenal. Obviously, we don't have enough free time to change. To regenerate. Okay. Modern life is equal constant stress. Okay. That's why I said to my patient, need to find time, especially before we go to sleep. Just let it go. Just relax. Whatever it takes, whatever puts a smile on your face. Okay, if it's watching the birds, fine. Walk on the beach, walk the dog, whatever. Just kind of get to your stress meter back to the green. You're ready for the next day. And by the way, very good sleep, at least 7 hours. Okay. Okay, overproduction of what? Of all these hormones, anxiety and panic attack. That's what panic attack. Panic attack is of the adrenals as they level of the emergency. Okay, it's so stressed that the blood clots full, and then every little thing is over. Now it's a life-threatening emergency. So adrenaline, adrenaline is like super production of energy, fast heart rate, elevated blood pressure, and you feel like it's frightening. So I explained to my patient, by the way, you can control it. Here's ways to control this. I meditate, supporting it, also tapping that we do, EFT, emotional tapping, you can look it up. Okay, certain homeopathic remedy. And the minute you realize it, just my way of responding to stress, just the fact that you know that you can control it, limit the effect of the stress. Okay. Fatigue, chronic fatigue as well. And of course, not producing enough energy. Of course, we learned what we eat, how we digest, how we eliminate. So it's all connected. Okay. Okay, so in other ways, and I mentioned this before, we support the thyroid. We have to support that. I equate it to driving a car instead of absolutely. Next slide. Okay, melatonin we talked a little about. That's also 𝘿𝒂𝙩𝒆𝑤𝙗. Okay, and sauna is up to 50%. Okay, and it's an easy implementation. Have spray. Okay, I know that pills I like to spray. Number one, you put it under your tongue. Absolutely. Okay, you don't have to open the bottle. Mostly take water, spill the water. Now you really. Okay. So what you do is you just spread out on the side of the bed. You crumble, then sprays. The next thing you know, it's morning. So sometimes I take a course of that. Right? And actually, I have more problem sleeping. The benefit of being an antioxidant with that cancer. Why not? I usually thought about that. If I feel it's going to be more than just to fall asleep. Yeah, I used to get very simple.
It is a lifesaver.
Yeah. And by the way, it's not addictive. And it's also, it's not. Okay, they can't hear me?
No.
Okay. Okay. There are some situations that some people would have vivid dreams and some nightmares. But if they do, and we have to do something else. CBD, we have other. But that's a minority, very small minority. People don't count already. Next slide. Okay, the sex hormone estrogen. Estrogen, we have 3 types of estrogen, E1, E2, E3. Again, produced by the ovary. And as we get into change of life, menopause, down the diseases. Again, we're considering menopause avoid a period for at least 1 year. Progesterone the same way. DHEA is a real for women, of course. The testes for men. Okay, and it's all controlled by the intuitive. Okay. We talked about the menstrual basic cycle. So we have 2 main hormones from the pituitary. FSH stands for follicular stimulation. That's the first hormone goes to the ovaries, down estrogen. So we have a little cyst called follicular cyst. Estrogen goes to a certain level, 14, and then it's age, luteinizing hormone. Hormone converts the ovaries from making much more progesterone, 100 times more than. Okay, next slide. Okay. Perimenopause, estrogen ratio changes. We said first progesterone goes down, estrogen also stops. So our replacement according to what's happening is the same. So, okay. Hot flashes, insomnia. Something else that I want to talk about, which is very ubiquitous, estrogen dominance. What it means is we just don't have enough the estrogen. So most of us are estrogen dominant. And we say, wait a minute, why men? Estrogen like, whether it be plastics, of petrol, okay, they affect men. Okay. Estrogen dominant, which means what? Increased prostate, breast, okay, and it's causing kind of impact from estrogen progesterone, so stimulation of the breast, the uterus. It's important to put it back into ratio to prevent, and it's not difficult. PMS is a dominance. Menstrual irregularity, progesterone deficiency, dominance. Endometriosis is the presence of endometrial tissue. Endometrium is the lining. It's supposed to be only inside the uterus. Endometriosis, that tissue actually out of the uterus, and now it on ovaries, on the bowel, etc. Endometriosis is not a nice situation to have because it can create. Because what happens is to bleed during the cycle. You don't want to have blood in your belly. Okay, so get progesterone comes right. Endometriosis goes away when you're pregnant. Why? Because when you're pregnant, you have dominance of progesterone. So the dominance of progesterone actually quite. Just the progesterone is pro-gestation, pro-pregnancy. Irregular periods, heavy periods, all dominance. Next one. Okay, also infertility, lower libido. We talked about the definition of menopause. Osteoporosis, heart disease, dementia. Unless we do what? Unless we do what?
Unless we see Dr. Dekel.
What's that?
Unless we see Dr. Dekel.
Okay, so again, vaginal very important. Vaginal dryness can be reversed in 2 ways. Okay. Loss of urine control, divided blood, urine, saliva, etc. Replacement can be oral, so, troche is like a can that we put in the mouth and just let it go into the membranes. I'm not depressing others because you cannot how much is going in, how much is swallowed, how much is being absorbed. Okay. The cream is probably the best because whatever you put on your skin is going to be absorbed. Okay. The pellet, big fan of it. Pellets are small little pellets that you have incision, usually, and you put the stitch, etc. That is what you put in your crucifix on that. And I've seen some patients with too much and then not. Some people it works great. I don't. to do it. Just I want to because if something you change in 4 weeks, I'm not going to call it out.
Hey, I have a question about the, because I have one of my patients that had pill, and she said that it works like into your muscles. She said they had to get and then pull it out, like because it intertwined into her muscles during that time period.
Okay. So number one, it should be in a subcutaneous tissue. Also, could be not only that,
And her bruise was about this thing.
you get in the muscle, you get bleeding. So it's a very shallow incision. You put so
Okay.
well, anytime you do, you invade the body things. Yeah. Okay.
Intramuscular.
Yeah, the injection.
I don't know,
Yeah. The injection. Men can have testosterone in 2 ways: either injection once a week or daily application. And again, it's about 50-50. Some men say, I don't like injections, they're great. And some say, it's more or less the same results from the injection. So it's a personal preference, whatever they want. Okay, next one. Okay. Okay. How do we take hormones? There are various ways of doing it. I like to mimic the original menstrual cycle, which means that the days that we had a period, we had a period. So my way is really mimic the cycle by giving you 25 days, 5 days off in order to not get receptors to downregulate. Remember we talked about quote unquote, and that works very well. The majority of will not have periods at the level that very small amount will. And again, if it bothers them, there's some changes. I don't mind them, so it's fine. And we monitor at least every 6 months. Okay, thermography. Anybody? Any heard of thermography? Yes. Thermography. That's a picture of it. It's really testing with an infrared camera. You say, what about mammography? Well, mammography involves pressure, tremendous pressure on the breast, and radiation. And it's been calculated that every time we do breast mammography, we're actually increasing the chance of getting breast cancer by 1 to 2% every time we do it. And I have women who do it every 6 months because why? Because they have breast. And if you read the NIH, National Institute of Health guideline, they actually say that women who have dense breasts should not have mammography. Not only they're not having it, they're having it because you can see it. So what do? I recommend thermography, which is the office, and ultrasound. Okay, so thermography is a physiological study. It looks at temperature, and physiological studies really precede any anatomical study. Physiological changes precede any anatomical change years. So we can look forward to how to prevent it before it becomes a problem. And the ultrasound looks at the anatomy, looks at lungs, valves, etc. So together we have a very good idea of what's happening in the breast. Okay, we can do bone density, which tells us how we before osteoporosis or osteoporosis. It gives us an impression how aggressive we need to do or be about stopping the osteoporosis and obviously. Next one. Okay, testosterone for women decline with age, especially after menopause. Next, we talked all about this. Okay, for men, as we said, we lose about 1 to 2% per year. energy, sexual function, muscle support, depression, oh, okay, again, osteoporosis and brain function, very important. Next one. Okay. We talked about estrogen dominance. Okay. First, we talked about estrogen progesterone ratio. Okay. And in general, most women usually need progesterone support to get and progesterone. Next one. Okay. Just we don't know that. Okay. By the way, if you read the right studies, because there's a lot of misconception about that replacement. A lot of women think that this increased breast cancer possible and or uterine cancer. Well, this titles Stay Young and Sexy with Hormone Replacement Therapy. If you read that book, you know that you actually see that take not that hormones correctly, you'll have less cancer, you have cancer than women who take nothing. Okay, next one. Okay, this could be, as you said, blood, saliva, urine. Okay, this is free. Again, when you say hormone, protein in the blood actually holds on to sex hormones. Sex hormone produced by the liver. This is really just the reserves, just in the blood, just can as basic hormone gets released, become free from the bond and acts. So when we do, especially the thyroid, okay, we can see the total. Free is the one actually does the work. Okay. And again, the probably the limits, especially as testosterone, because you can see testosterone for men, anywhere from 200 to 1200. So 201 is okay, and 1199 is okay. The problem is we don't take levels of testosterone from men in their 20s to get a baseline. So goes to the doctor at 201 or even 200. I have see my muscle mass. I have no energy. I cannot work my libido. Get an erection. I'm depressed. Oh, I'll give you something for depression. No problem. You're not going to get this. So, as a man, have more than 200. That's a shame. The number one cause for men's depression up to 50. Okay. The issue is, for lack of better words, doctors are not educated about it. They're afraid to use it. It's got a bad rap because of this muscle building, etc. Can't live without testosterone. Okay.
Conventional medical schools today, the average hormone is about 5 to 15 hours. So
Well, and what's crazy was, you helped all of them. But they had, you told my grandmother, uncle, like all my uncles, grandmother, my dad, they all had and put them all on SSRIs and decades, like nothing helped. And then whenever we just had a conversation about it, and like he was like, "You have to do a blood panel." When we did a blood panel for testosterone, was like, whenever testosterone, they were like, lives. Completely, like, no, they went like, it was like a complete, so like, I really wish like just the doctors all around the board, it's not like it's really raging. Like,
Next slide. Okay, we talked about administration could be creams, injection, troche, and pellets. I'm sorry, every 6 months. When we take testosterone, especially men, a few things you have to monitor. Number one, they can be converted to estrogen, more than others. Okay, so we need to actually prevent that with high estrogen for men. It says increased prostate size and also breast size. Also, it stimulates the bone marrow to make more blood cells, which is not bad. Increases oxygen carrying capacity. But if it increases to the point of becoming too high, that means that the blood gets sluggish. It's a little harder to pump it. And the blood flow slows down, which increases the possibility of blood clot. Okay. So if that's the case, if they convert what we do, we order for medication to stop the conversion of testosterone to estrogen. If they make too many red blood cells, they become very good friends with the Red Cross and donate twice a year. That's it. Okay. Okay. Actually, we talked about that. Lack of I patient male comes to me and they don't have a morning routine. They don't have enough testosterone. I'll do the blood test anyway just to see what we are. But that's it. Youngest patient with testosterone is 22 years. It's really, really alarming, but that's the way it is.
We've seen it actually go lower recently on the direction.
Yeah.
Of the,
Younger men can respond to another hormone called HRT. The testes and tells it, okay, make more testosterone. But somebody over the age of 55, etc.,
I'm actually utilizing that right now to off of HRT. To now rebuild and boot back up so I can get off of being. I was at the 1 mil a week, and now I'm down to so a fifth of what I would usually be on, and I feel great. I'm excited.
Also, we need to be aware, give testosterone, also we sperm try to conceive, to be aware of it. And so, and see. Okay. This does increase testicle size usually if you you really take it over physiological levels. But if there are patients, I haven't seen any, but good physiological. Okay. We talked about conversion, and crisis stops the conversion of testosterone to estrogen. Okay. And there's 𝑬𝙤𝒄𝙗𝒄𝙗, etc. This inhibitor, this is the enzyme convert testosterone to estrogen, but it's not going to convert. Next.
𝑬𝙤𝒄𝙗𝒄𝙗 and 𝑬𝙤𝒄𝙗 listing medication. Just here.
Okay, these are sources that I suggest testosterone. Okay. Say I'm in sexy with hormone replacement therapy. I already said that. I think that's the last.
Yep.
Yes, sir.
Okay. Good. Actually, it took about 10 minutes longer than I. Okay. Any.
A couple.
Yeah.
So
You said that blood pills
Yes.
or the urine or the saliva. So it's three of them
No.
or
I usually do just.
just the blood.
Yes.
Okay. I was told by someone to get the wine test, urine test, because it's more accurate. That's what they just said to me, and I don't know if they were trying to sell me something that they are trying to make money off of.
Okay, you have a comment?
Yeah.
Oh, okay, good. Sure.
You want to get a very, as you said, accurate count. We'll have to be able to test you 5 times in one day, because from the moment you wake up to the moment you go to bed,
Everything fluctuates.
exactly. And so what we have to do is every 2.5 hours a day, we have to go and get a blood and a saliva test. And that would all have to be done for 2 hours and 2.5 hours throughout the entire day, at least 5 times. Then we'd wait for the results and then get the median average on the score. That would be considered your accurate. But how many people have a day to just sit around all day and take classes on it?
So you would have to do
I'll make it easy for you. Any testing can be fine. It's not a problem. I wouldn't say urine is more accurate, blood is more accurate. Okay. Blood because it's convenient because they also do a complete blood analysis of everything else. Okay. And get it into make it easy for the patient also for the patient. Okay, and we get good results. In other words, we get a good analysis. Top of that, I actually do muscle test and kinesiology, which is to combine, and between the both of them, I get the right result.
Okay.
Good question. Yeah.
Yes, so say you have a 54-year-old woman
Yes.
has a
That's love.
estradiol 33.4 down
On the
from
low side,
81 in
6 months before.
and TSH of 4.05. So they haven't had a period since end of 2022,
Yes.
and a gynecologist said that they are still in perimenopause. Are they postmenopausal or perimenopausal?
That's 50% of women that don't have a period. How long?
Since 2022 October.
Definitely menopause.
So in menopause still, not postmenopausal?
Well, menopause is still less ill. The rest of that patient.
Yes.
So yeah, menopause with the same trend. So perimenopause is as we lead to menopause. Menopause is when we didn't have a year.
Right.
Premenopause, postmenopause, same.
So
Same
first
kind of.
I wanted to say that it
Yeah.
it was perimenopause. So I'm still, it's in the flow of like, that's why I need to come to you. That's where it needs to be.
Yes.
It's too long since it's been, since it's on the decline. Okay.
Is this patient on hormones?
Yeah.
I guess so. For that specific patient, I would advise that we actually analyze it and put it on the fire and hormone.
Okay.
Absolutely.
And I would tell your friend she'll feel a lot better. It helps out your sex life too.
Any other questions?
Why do you think that only 50% of insomnia do you think is causing it, or is
Okay.
it the imbalance
Okay.
of hormones that it?
Okay. The question was, what do I think that 50% have insomnia? Are we talking about specifically senior or just across the board?
Because I do have a lot of clients that come to me that have a lot of sleep problems.
Okay. Well, the sleep is very complex.
So
Yes. Number one is, do we have enough melatonin? Number two,
okay.
how many of us tell us release the stress?
Mhm.
A lot. Okay, so what happens is 2 o'clock in the morning, we wake up. Something introduced right away. I had the problem yesterday at work, and tomorrow I'm gonna have another problem. And by the way, my kids are sick or husband is whatever. Just don't stop eating. And we need to do it. Would it be meditation, with prayer? So many varieties of how to reduce stress. I mean, I just came across an app called Nucalm, Nucalm, which is really an app of music in which they embedded certain frequencies. Just okay, and they have 7, 8 different programs, and one of them is free. One of them,
Lowers.
the other one is actually you put 40 hours,
And
and you can use it. You can use it for free. to see if this works for you. Decide if you want to purchase the arm.
They actually have
Yeah, I was
a,
about to say,
on YouTube, you can actually try them as much as you want.
Oh, really?
there's one, and it's so good.
Yeah.
Put it on,
Those result like
you crash
10%
out.
within
It's
a minute.
amazing. Like, I actually touch my belly so much because I mask and then that music.
What is it, the brand or app?
We'll post it on the YouTube video, like below. We actually came across it accidentally here, just like give it. We found the right frequency for it, and it worked really well. It's
Did I answer your question?
I think so.
Again, there are
Some-
other issues that sleep apnea is one big one. So again, you can treat that, which is usually for weight, etc. Talk about digestion. We have to know information. We need to talk about multiple things, stress by itself, etc. But considering sleep is more important than food, we have to address it. We need to address it. Any other questions? We're good? Yes.
Replacement therapy?
Yes.
Number of blood tests that have to do.
Do it once a year. That's enough. So again, we actually see how you feel physically. That's fine. That's enough. Any other questions? Good? All right. Thank you very much for coming. It was a pleasure. Okay. When is our next question?
We'll be in 2 weeks. This will be for everyone, including everyone online. Every 2 weeks, we'll be having live here at the office. It's going to be at the same time, usually about 1 to maybe 3 o'clock at the latest. Just kind of depending on what's going on around in Bluffton. Obviously, Bluffton has a lot of events. So we'll try to and go to church, so we try to give them time to go to church and not have to be in a rush to get here, like when our the show. But every 2 weeks we'll have a different topic. It's going to be thankful.
And if there's
You
something
can bring
that,
your questions.
Yeah.
well, and if there's something you guys are like, I want to know more about, we can add that in.
Yeah, just message our page, email us if there's any questions for video that you want to make. And make 30, 45, or even an hour long video. Tons of content.
Deep dive into food or whatever.
So I'd like to, my crew, for putting up here in the back, so enjoy it. And we'll see you in a couple of weeks.
Thank you.
Great day. Take care.
Who wants to go have fun and try?
About to go demo everything at the office. See you guys. Oh, hold on. Before we end the stream, let me take y'all around the office. This is our little table over here. We've got some delicious snacks, drinks. Thank you. And
What was that?
hold on, I'm still live. I'm just giving them a little tour.
Well, this is my room.
Aesthetics.
I'll give it.
So sorry, I'm hoping not making anyone
Okay, so
nauseous. So
basically, this is not. We're not fully up yet.
Yeah.
Because we still have to add our shelving and all that good stuff. But okay, this is like a little seating area. You can be like, oh my God, Kelly, I want to see one of our estheticians about the hydrofacial or microneedling, or I want a facial peel,
Or a
I
massage.
want a massage.
or a hot stone massage.
But massage is in another room. So this is gonna be over here with the Optimist, so you can have a wonderful. If this is a warm stone massage, you can do this, and it gets away all of your wrinkles and tightens it up. Laser hair removal, it's huge, and it's like it really isn't painful at all. And I would show you, but that would be very inappropriate. Iron hair resistant is fantastic. You know what a man feels like showering. And then obviously the most famous piece of all, the Morpheus 8, which we have.
And I would also like to mention that the diode laser on BioLaser XL, which is our laser hair removal. It has a cooling tip, so as the skin gets warm, as the applicator is moved around, it's cooling
We're
that
gonna
skin
pause this way.
at the same time. So it's nice, and it's the most powerful diode laser on the market.
Okay, so Brandon, where are we at right now?
This is our 𝑬𝙤𝒄𝙩 Neo and Sauna ray. So it's pretty much our day spa room.
So you can basically get a massage with Miss Eva and be extremely relaxed, and then go from there, not with clothes on, and going through over here. You can't wear a shoe. Which actually we're gonna do once we're done with the live. And then sit here.
Yep, and that's pretty much it. We will see you guys in the next 2 weeks. We're going to be dropping some live videos and some other videos about some of the services that we have over the next couple weeks. So you can expect at least 3 to 4 videos a week from us on the YouTube and our Facebook. So we're very active on Facebook. We're trying to grow our YouTube channel, so help us, show some support. We love you guys.
Support our small business.
That's right.
With a big heart.
Take
And
care,
remember,
everybody.
attitudes are contagious.
That's right. That's our catchline. Remember, attitudes
So
are
say that's your
contagious.
catchline.
Is yours worth catching? We'll see you guys later. Love you.
Bye, y'all.
Bye.